Alright. For you guys coming in, just have a seat anywhere. Welcome to Badger Volunteering Association. Is everyone excited? Is everyone excited? Yeah! You got to know my residents anyway. So basically, first we're going to introduce some of the members so you guys can get to know who the officers are and some things about them. So I am Mario Adamaj. I'm the president of BVA. My major is biology, and I'm also getting a certificate in global health. And my hometown, I'm originally from Pogradec, Albania. You guys might not know where that is, but it's in Southeast Europe. But my family right now lives in Milwaukee. This is Andrew.
I'm Andrew. I'm the vice president, so I'm helping Mario with the administrative stuff. I'm a microbiology major, and I'm from Wisconsin.
I'm Ellie, I'm a friend, like Stone. I am the treasurer, so I do with all the funding. And I am a poli-sci major, but pre-med for sports medicine, orthopedic surgery. And my hometown is just outside San Francisco, so just hop over the Golden Bridge, and there I am.
Hi guys, I'm Paulina. I'm the secretary of the org. I'll be the recorder of everything at BVA. My major is psychology and Spanish, and I'm also pre-med. My hometown is a small city in Albania, but I've been here for 7 years.
Hi, I'm Mikhail Twerdik. I'm the community outreach chair, so I do kind of the online stuff like Facebook and Twitter, and then also like meeting members and also like telling everybody in the community what we're doing. I'm double majoring in neurobiology and psychology. I'm from Minneapolis, Minnesota.
I'm Nikolai Gerhardt. I am a freshman outreach chair. I'm from University of Wisconsin. I have not yet declared a major, but it will probably be chemistry.
I'm Eric Larson. I'm the other freshman outreach chair. My major is going to be biomedical engineering and pre-med. I'm from Milwaukee.
Just so you guys know, all the officers have been working really hard this past week to get this put together. Can we give them a round of applause for all the officers? All right, just so we have an overview of what we're doing today. First, we're going to discuss what BVA is. I know you guys have a lot of questions. We're going to kind of discuss the general overview and infrastructure of the new org. Then we're going to go into detail about kind of volunteering events that we're going to be doing for the year. Then we're going to discuss some of the events that we'll be doing this week that you guys can participate in. And then I have some news and announcements for you guys. And then we have the legendary Dr. Patrick Remington. He's going to give a short speech. Dr. Remington is going to be the BVA faculty advisor, but we'll go more into that later. Then I'm going to give you some information about the website and how you guys can use it. Most of you guys have been on there, so you guys can kind of have a feel how to use it, but we'll go more into detail. Then we'll officially be members, so we're going to have a short initiation. And then that will be the whole meeting. After, you can come and ask us any questions that you guys might have, and we can take care of those. So first I'm going to read what our purpose is as stated in our declaration. Our purpose is to provide UW-Madison students with volunteering opportunities around our and other communities. The Badger Volunteering Association is an organization dedicated to bridging students to the areas that they have interest in contributing to, whether that is through medical, educational, or social volunteering. We set ourselves apart as an organization because we set up volunteering opportunities based on the specific interests of each of the committee members. Alright, so I'm going to go into some of the goals that we have, some more specific goals. So obviously, like I mentioned, this is, the majority of you are pre-health. So this is for pre-health students. So one of our main goals is going to be to bridge pre-med and pre-health students to medical volunteering opportunities. We're also going to expose some of the members to the different areas in the medical field. So we're going to have guest presenters coming in to talk about their specialties in the medical field. We're going to take field trips to medical schools. We're going to take trips to hospitals and tour some of the different departments in the hospitals. But we're also more than just a pre-health org. We also do provide volunteering opportunities for those of you who are pre-health, and we can go more into detail a little later. Now we're going to talk about our theme. You guys might have heard a little bit of this during the org fair. But the main theme of BVA is we concentrate on preventative care, on the preventive care aspect of medicine. So what that means is we're going to be working with mostly youth and college students to kind of help them start developing healthy life habits so that they don't end up developing cardiovascular disease in the future or other diseases that we're prone to as human beings. So, like I mentioned, during your college years and during the early child years is when you start developing your life habits. And BVA is going to try to make sure that those life habits are going to be healthy ones instead of ones that are going to put you in a situation that guy's in the way. So, again, we're going to promote healthy lifestyles on campus. We're going to have different activities to do that. We're going to teach healthy life habits to youth and children, like I already mentioned. We're going to have different physical activities for UW-Madison students. And we're going to partner with American Family Children's Hospital. And we'll go into more detail a little later about that. And then we're also going to provide leadership opportunities to members. That's something that makes us unique as an organization. We're going to allow you guys to determine how you want to tackle health issues on campus or in school environments. So we're going to cater to your interests. Basically, we're going to allow you to form your own committee, and you can be chairperson of that committee. And there's going to be a lot of benefits to doing that, as we'll discuss later. But in this committee, you'll be in charge of designing and planning to tackle health issues on campus. And obviously, you can have more than one chair to that committee that you'll be working with. So if you ever have an idea of an event, program, or volunteering opportunity that you would like to see on campus, let us know and we're going to help you set that up. And obviously this is going to look really good on resumes, but I really don't want any of our members to be doing this for our resume purposes. I want you guys to do this for passion or for to get training for future careers or whatnot. So from what I can tell, most of you guys seem to be good kids, except for that guy. This picture kind of shows our system. So like I said, the main part, the large part, that's going to be the core of BVA. So all the members are going to form the core. And we're going to be providing opportunities as officers for you guys to be involved in. And that's through the core. But all the little hearts that are attached to the core, that's going to be your own separate committees that you guys decide to form in order to tackle the health issues. So that kind of is a little diagram. It took a long time to make, so I appreciate it. Now we're going to discuss a little bit about membership requirements. In order to be an active member, you have to have a minimum of 30 service points for the year. 30 service points for the year is definitely not a lot of service hours for a pre-health board, because we really don't want to force you guys to have to contribute time and effort if you don't have the time and effort during certain weeks or whatnot. So we made this organization so that you guys can dedicate to it what you guys want and what you guys can dedicate to this. And you guys are going to get out of this what you put into it. At the end of the year, you're going to see, look back all the different things you got to do and how you changed lives, whether that's directly or indirectly. You're going to feel proud of yourself. So whatever you put into this, you're going to get out of this. Every meeting that we have, so this would be a meeting. We're going to have meetings every other Tuesday. You get one service point right there. And that's already 15 to 18 service points, because we're going to have about 15 to 18 meetings for the year. This also includes outside meetings that you might be having with the specific committee that you might be joining. So that obviously will assist in tallying up 30 service points. So basically, it's pretty simple how this works. 1 hour of volunteering gives you 1 service point. Pretty simple. We're going to determine how many hours each activity and event and opportunity will have. We'll send that through emails or whatnot, so you guys know. There are membership dues for this. You can either pay $15 for the semester or $20 for the whole year if you know that you want to be dedicated to this, or for the whole year. We're going to be using that funding to we're going to be using that money to kind of fund some of the different projects that we have in mind, some of the field trips, and different materials that we might need for the different presentations that we'll be doing or whatnot. So, if you plan an event or decide that you want to head a committee, you automatically receive 3 to 5 service points. We'll determine how many service points you need. So say, for example, that you want to plan a soccer game for a weekend, and you want to have a committee to kind of arrange everything and whatnot. You send Paul, the secretary, an email saying what you want to do. We will reply back saying that this is how many service points you will get. And then if you successfully complete the activity or not, you will receive those service points. Forming a committee, obviously it's easy. You can form a long-term committee where it's dedicated to maybe some more long-term goals to help college students get into healthy life habits. Maybe having sporting events every weekend or whatnot. Or you can have a one-time event, and that still will give you service points. You will be submitting any volunteering hours to Paula Rota. Her email is on there, but we'll also have this on the website. And then another requirement is you can't have any more than 3 unexcused meeting absences. And that meeting absences meetings only for the whole group, not the individual committee meetings. And notice that says unexcused. I understand that you guys are busy. I mean, most of you guys are pre-health, so you have a lot of tough classes and busy schedules. So if you guys need to get off of a meeting, send us a request for that, and we'll take care of that. We'll give you an excused absence. But you can only have 3 unexcused absences. Now we're going to talk about what we'll be doing with the American Children's Hospital. So first of all, throughout the year, we're going to host different fundraising events and activities for the Department of Pediatrics. We're actually going to make a specific committee dedicated to coming up with specific fundraising events for the Children's Hospital. We also have formed the BVA AFCH Alliance, so you will be able to receive service points from Badge Volunteering Association if you volunteer with the American Family Children's Hospital. So I can kind of talk you through some of the more specifics. So first, some of you guys might already be registered and have gone through the orientation to volunteer at the American Family Children's Hospital. If you have, that's great. If you want to do that, you can definitely do that. You go on the UW Health website, go through the orientation, register, become a volunteer for AFCH. Once you do that, you can join our AFCH committee. We already have formed a committee, and these members, so however members are going to be, these members are going to be working together to kind of plan different activities that they can do together to bring to the children at the American Family Children's Hospital, and you will be receiving service points for that. So it's kind of like killing I almost said 2 stones with 1 bird because I said that once, but it's killing 2 birds with 1 stone. With 1 stone. Clearly my language skills aren't the greatest. Anyway, so you can have twice the reward basically, so your time spent volunteering will count towards AFCH and BVA, so you get up to 5 service points for the year if you decide that you want to volunteer through AFCH. And also keep track of the number of hours that you volunteered with AFCH, whether that's through their specific duties that they assign you or through the specific activities that you plan with the AFCH committee through BVA. Because at the end of the year, I will sign off kind of a little certificate of the number of hours that you spent volunteering. So you can have both hours for American Family Children's Hospital and BVA. Okay, so these are some more specific things that we're going to be doing. It might be a little small to read, sorry about that. So like I already mentioned, we're going to have weekly sporting events or tournaments for college students to participate in. So that's soccer, basketball, frisbee, football, whatever you guys want to do. We're going to host events for local high schools, middle schools, and elementary schools. Sporting events or other health education events, just to kind of get them in the habit of living healthy lifestyles so that they don't end up reaching that point where they have a disease that they have to worry about or whatnot. We're going to host dance activities and lessons, races, walks. We're going to, in a few weeks, we're going to do an Alps ropes course. This is a physical activity and also a team building activity. I'm going to have a couple of pictures after this kind of showing what it really is. We're going to do a lot of outdoors recreational activities. This is more for the non-pre-health students to get involved with us. So we're going to do, for example, one of the events is the UW-Madison Arboretum hike that we'll be doing in the future. We're going to have relaxation events, especially during exam time, to kind of relieve some of the stress from the students because, as we all know, there have been multiple studies where it links stress to health, negative health outcomes. We're going to do some tutoring services with different local schools. We're also going to do some volunteering with children from the Ronald Reagan House. We're going to do environmental cleanups. We're going to have trips to different areas. We're going to do healthy lifestyle workshops for children of underrepresented backgrounds in Madison and Milwaukee. So there's some time in Milwaukee. So we'll be taking some trips down there. And we're going to do alcohol and health workshops in Madison. These are some pictures of the ropes course. This is the Alps ropes course we'll do. Obviously, it's a physical activity, so it kind of promotes living a physical lifestyle. But also, it's very, it's basically promoting teamwork and team building. So, how much do you trust me to hold you up? That's basically what we're going to be doing out here. You can tell, I don't have to answer that, so it's all about trust. All right, so this week we're going to have we have a few different interesting opportunities So University Housing has asked BVA to create a program on alcohol and your health, kind of an educational program. So we formed an alcohol and health committee. We set it up online already. So you can join this committee and kind of lead a plan, kind of design a fun but educational program tackling alcohol issues and health consequences. Obviously in Madison, the alcohol consumption rate is a lot higher than other places. So it's a major issue. So we're not going to do an activity condemning alcohol and saying no, because we're going to make it interactive and fun. So if you guys are interested in participating in this, you can head and develop a plan and whatnot, and you'll be receiving 3 to 5 service points from the get-go. So if you guys are interested in that, email me or email Secretary Paula, and we'll have the email addresses online. Like I said, you can have 3 service points already from this if you help plan. So if you're interested in joining us. Also, we have a really short deadline for this. We're going to have to present the activity next week. I think it's Tuesday or Wednesday. So we really have to start working as soon as possible. So if you guys know that you're interested, send me an email today or maybe tomorrow, and we'll get together and start working on this and promote healthy lifestyles. Some more volunteering opportunities this week. We're going to have a blood drive on Thursday, September 22nd. On the website, there's a calendar where you can go and click on the activity. You can kind of see more specifics on that. I update those as soon as I can, as soon as I have the chance to. So look at that. We're also going to have, for more of the not-prehealth students, a nature preserve volunteering where you get to help remove invasive species and prepare for fall seeding. That's going to be on Sunday. So look on the calendar for these events. Okay, we have a problem, and the problem is that we're not artistic. I tried making a logo, and that's all I got. So we have something. A for effort. So we have something kind of cool that we're going to do. We're going to have someone in here. I'm sure there has to be someone who's artistic in here. Maybe not. We're going to have someone in here. We're going to have kind of a design contest for the BVA logo. Whoever wins the design contest, we will select as a group the winning design. But whoever wins the design contest for the Bad Volunteering Association logo will get 2 service points already. Ooh. And even more cooler, the founding father of the BVA logo. That's pretty cool, right? Now we're going to go to the guest speaker, Dr. Patrick Remington. Dr. Patrick Remington, like I said, he is going to be our faculty advisor. He was one of my professors from last year. Actually, his course on global health is a course that kind of inspired me to begin this organization. He has a lot of interesting things that he's done in his life, and we might be going into that today. But some of his accomplishments are, Dr. Patrick Remington is a well-known doctor, physician, researcher, and whatnot. There's so many titles you can put to his name. But some of his accomplishments, he served on the Federal Advisory Committee to develop Healthy People 2020, which is the nation's 10-year health plan. He was selected to give the Alexander Langmar Lecture, which is the most distinguished lectureship in epidemiology in the United States. And his county health rankings is a nationally recognized model for mobilizing action for community health. You guys might have seen on the UW homepage his picture with him smiling, kind of goofy. But obviously he's getting a lot of attention, not only from Madison, not only from Wisconsin, but from all around the world because of what he's been doing with his county health rankings. His biggest accomplishment, though, he's a happily married man with 4 healthy and happy kids and a new daughter-in-law as of this summer. So let's give him a round of applause.
Well, so last time I was in this room, I was a pre-med student on campus, but you have to take those other courses for Brett, and I took taxonomy, which was a big mistake. So I then took a pass-fail and discovered that was even a bigger mistake, because basically if you don't pay attention, you will fail taxonomy. So it was a really, I don't have fond memories of coming into this room and memorizing things that I haven't really used that much later in my life. So I went to undergraduate here. I was a sort of chemistry biology student. I took 2 years of college, and then I I needed to take some time away because my friends were taking the MCATs, and I said, there's no way that I'm ready to make that commitment. So I called my junior year abroad. My dad said I dropped out of college. But I had some time away, enough to know that when I came back, I was really interested in going to medical school. So I finished here with a degree in molecular biology. Any molecular biology majors? Is there such a thing? Maybe one. It prepares you for nothing, really. You have no skills, you can't get a job, but you can apply to medical school, which I did and went here. My problem in medical school was that I was interested in everything that I did. So I was actually interested in pretty much the basic science stuff, and then I was really interested in the clinical years, and then every time I rotated on a different rotation between pediatrics and OB-GYN and internal medicine, I was interested in that. So, guess what happened? My last rotation of medical school was a public health rotation. And I left medical school most interested in the last thing that I did, which was the public health rotation. I went uptown to the state health department, and I sat down in a chair, and they told me that I was the epidemiologist. I didn't even know what an epidemiologist was. But there were some people who were sick in a community, I think it was Appleton or Oshkosh. So I went up there and asked a lot of questions and figured out that somebody had brought salmonella, typhoid fever into that community. I asked a bunch of questions and figured out who was the index case. I also worked up and solved the problem where people were getting strange bumps on their arms. We diagnosed it as sporotrichosis. It's a fungal infection that comes from a fungus that lives in sphagnum moss. These people were building grave sprays in the winter down in Racine. To make the grave sites very pretty, they put pine boughs in sphagnum moss and built them. But the problem with the pine boughs is they injected this fungus into the people's skin. So it was really fun for me to think about how I, could solve these problems. I felt like, CIS, is that what it's called? CSI. There was no CSI back then, but I felt like if there had been, that I was doing CSI kind of work. Well, then I decided to do my internship in internal medicine, and what happened to me was a little different than happens to a lot of medical students, in that rather than focusing in on the patient's problem that was really presented to me, although I had to do that, and I was not bad at being a doctor, I was more interested in what brought that patient to this hospital at this time. So I found myself always asking myself the question, what could have been done to keep this patient from needing the care they were getting? Because, as you know, many times care is provided too late and does too little for patients. So I sort of told people my motto was that as a doctor, I wanted to keep people healthy, but if I don't, I'll fix them. Like fire departments have that same motto. Fire department, actually the motto of fire department is to prevent fires, but if they don't, they put them out. So to me, the best thing for medicine was to prevent disease, to promote health, but if we don't, we've got hospitals and doctors that can fix people. But I found that where I was in Seattle, in a tertiary care hospital, I wasn't in the best place to think about prevention. So, and actually, I tried a few times to ask the patients these questions, and I learned really quickly that the patient's not in that place. The patient is not so interested in what they could have done to prevent the illness. I remember I was having to remove some chest fluid from a surgeon who is dying from lung cancer. And I just wondered, he smoked cigarettes his entire life. He's a surgeon. He took tumors out of patients. And I just was so tempted to ask, why did you smoke cigarettes when you knew that it would kill you? I didn't. He was a very angry man. And I was afraid he would kill me. And it really isn't the time, sitting with a patient, to ask, why did you behave the way you did? Why were you exposed to the things you were exposed? Didn't you know? Weren't you able to find resources to prevent these things from happening? You know, most of what we see in medicine, at least half, and maybe 2/3 of what we see in medicine is entirely preventable, easily preventable with science and technology that we have today, but yet it's not. So I found myself thinking about what could be done to keep people healthy. And so I did you might call it a right angle turn, some people called it a 180-degree turn, and then I decided to go to the Centers for Disease Control. Do you know about CDC, people? So CDC is in Atlanta. It's the nation's public health agency. And I went there to learn epidemiology. And is that a term used in college today? Was epidemiology? It's the study of the causes of disease. It's really sort of CSI, but for health. What causes people to get sick? Why are some people healthy and others aren't? So I went to CDC. I spent 2 years doing epidemiology. I spent then a couple more years doing a preventive medicine residency. There's actually a specialty in medicine called preventive medicine and public health. And then I stayed on at CDC, and that's where I had 3 of my kids. Bought a home, settled down, and was very happy working for the federal public health agency. But then a job came up in Madison, and I'm born and raised here. My dad actually was a law professor within shouting distance of here at the law school. So to me, the opportunity to come back to campus, be with my family, my extended family, my wife also was a graduate of this university. So we came back, and I spent 10 years in the state health department doing public health. So I'm a physician, but I don't see patients. I see entire communities and populations, and I ask questions like, what could be done to reduce the chances of people getting cancer? What could be done to design communities or schools to be healthier places to live and to work? I just read a story today that the rate of stroke is increasing in young people, as young as 15 to 24 years of age. This is really the first signs of the downstream effects, the health effects of the obesity epidemic. Stroke, 50% increase in the risk of stroke in young people as a result of the obesity epidemic. What are we doing in medicine? Probably not such a good job in detecting and treating those strokes. But what can we do to prevent them? So I spent 10 years at the state health department, and then I came over to the university to work in the medical school. And one day, my dean came up to me and said, you know what we should do to think about medicine differently? We should change the name of our medical school. Does anybody know what the name of the medical school is? We're the only medical school in the nation that now be called the School of Medicine and Public Health. So our medical students, I gave 2 lectures to medical students this morning on epidemiology. They learn right alongside with how to detect and treat diseases. Our medical students learn how to prevent diseases, how to improve the health of people living in communities, how to design communities so that they're healthier places to live and work and play. So that's what I do for a living. It's not so exciting sometimes because I don't ever get to see the people whose disease I manage to prevent. I worked a lot in tobacco control. You guys don't realize it, but when I grew up, there were ashtrays in this building. People smoked in lecture halls. Certainly until about 2002, everybody smoked in bars. Until 1990, people smoked in restaurants. So we worked very hard to get smoking out of schools, out of restaurants, and finally out of bars. And now, many of you grow up not being exposed to smoke. How many people here live in a home where neither parent smoked? So that's astounding. How many of my parents smoked? Both smoked. My dad died from lung cancer at a relatively young age, 73. A tragic death. But he smoked during the war. A military policy was to provide GIs with cigarettes and C-rations. The tobacco industry did that intentionally. They knew exactly what they were doing by giving GI cigarettes. Get them hooked, so when they come home, they're going to have a hard time quitting. Tremendous industry activities to get people addicted to cigarettes. And by the way, it's not changing. I could learn a lot from you about the new industry tactics to promote products that, as we used to say, when used as intended, kill people later in their life. So for me, it's a little bit frustrating because as a doctor, when you see somebody with a problem, you're an orthopedic surgeon or an internist or a pediatrician, and you get to diagnose and treat and see people walk away, it really feels good. Sometimes in public health, you don't have that same reward, except in a big sense, in understanding how people benefit. So I'd be happy to answer any questions. I think this is a great opportunity. This student group is a great opportunity for you to get engaged, to think about health broadly, not just what happens in the hospital, but what happens in the community and why some people need the services provided in the hospital. So I'd encourage you to be broad in what you consider to be health, that medicine is good, but the best medicine is prevention. If you can prevent problems from occurring, we'll put all the hospitals out of business, and everybody will just end up not needing medical care. So any questions, Ryan, Mario, how do you want to? You probably got more to do here, so let's give a round of applause.
Before I continue with this, I just want to make a quick note on something else. Pizza? I just want to make a quick note on something else that we're going to be kind of taking care of while going on all these different opportunity events and whatnot. As you guys can imagine, we're going to have a lot of interactions and connections with different students, people of all ages, children, and whatnot, even maybe adults. So with that, something that you guys might not realize that's going to be happening is we're going to be kind of developing a tool, a tool that I think is really important, and the tool is kind of developing strong interpersonal relationships with people. The reason that I really stress this tool, especially for those who want to go into medicine, is because it's such an important tool to have as a physician, as a nurse, as a whatever. A few years ago, my father was diagnosed with pancreatic cancer. And that was, my family has never dealt with a health tragedy like that or anything. So we were kind of all lost in the world, and my parents don't speak perfect English, so I had to go and translate to the doctors and whatnot. And I set up as many appointments as we could, just because it was a late stage of pancreatic cancer. And one of the doctors said that he only had 6 months to live left or whatnot, so we were all kind of panicking. But what we noticed, first of all, to give you a little background, in Albanian culture, it's really important to concentrate on the interpersonal connection between patients and doctors, and eye contact especially is really important, just because the patients give the doctor the full trust, and the doctor has to take care of that trust. And that was the expectation that my dad had for the physicians that he saw. But with every physician that we saw, every appointment that me and my dad went to, I can see my dad's kind of hopes and morale, hopes and morale kind of going down, and that wasn't a physical issue, it was more of a mental issue. A lot of the doctors we saw, they come in, heads down with paper, blah, 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 what's hurting, blah, 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 how tall are you, and blah, 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 and then they would just leave without even making eye contact, without kind of taking care of that key ingredient between the patient and the doctor, that interpersonal relationship. So I just want to make sure that you guys understand that one really strong tool that we're going to develop is kind of learning how to build strong interpersonal relationships with people that we work with and see, just because it is so important in the medical field. And battling a health issue is just as important to kind of fight it mentally as it is physically, because I think it's half a battle. Just because if a patient feels like, oh my God, this doctor doesn't really care about me, he's really not trying his best to help me out, then he kind of loses the battle, he is losing the battle. So for future reference for any of you who are going into healthcare. And that goes beyond healthcare, just because you could need this with any interaction that you're going to have with human beings. That's another tool that we're going to be developing as a team. So I just wanted to share that just so you guys know, but now we can continue the PowerPoint. All right, how many of you guys have seen the website yet? That's not a lot of you. How'd you guys get in here? We're going to be using the website for everything, so any questions you will ever have, you go to the website and check it. So I'm going to kind of go through these categories so you guys know what's on the website. First of all, the website is groupspaces.com/Badger Volunteering Association. Our main communication is going to happen through this website, so kind of really get to know how to use the website. It's pretty simple, but it's really effective and efficient. On there, there's an events calendar section. That's going to have all the different events that we're going to be having. Sometime every 2 weeks, we're going to be sending an email to update with different events. Plus, we'll have this meeting regularly to kind of update. But if you have a question about what event is going on or what are the specifics about the event, information like time, shifts, whatnot, go to the calendar and it has everything on there. The other thing you support is to form this committee. So if you do decide that you have an idea that you want to tackle a health issue by doing this or planning a sporting event or whatever you want to do, that's why we leave this in your hands, give you some of the responsibility to become leaders. You can form your own committee on the website. So on the website, when you look, there's going to be all these committees, and each committee has a different color sign. Once we help you form that committee for whatever it is, everyone else is going to be able to see it so they can join in with whatever you need help with, planning and whatnot. And don't forget, they give you 3 service points for every committee that you form, every event that you place together yourself. Like I said, news updates. There's a news section on the website, one of the tabs. Anything that I want to share with you guys or let you guys know, like for example, the logo contest or whatnot, it's going to be on there. So check that regularly. Before you come to any of us with a question, go to the website first because I guarantee it 99% of the time it's going to answer. But if it doesn't, then come and contact any of us. There's going to be a section called Files. Because this is a new organization, because many of you might not kind of really know exactly how to go about doing something or forming this committee, what's it talking about, this committee stuff. We're going to have a file section where we're going to upload documents explaining how to do stuff. So everything's going to be like how to form your committee, how to join an event, how to blah, 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 how to volunteer with this. And every section, every document is going to have something that walks you step by step so you know exactly how to do it. Because like I said, most of the stuff we're doing through the website, so you're going to have to know how to do it. And that will give you a good, really step-by-step how to do it. With that, congratulations, you guys are BVA members officially. So give yourself a round of applause. Like I already mentioned, we are a brand new organization. This is the first year of this organization, so you guys being involved in this could turn into something huge in the future, maybe national in the future. So who knows, in 5-10 years, you guys can come back and see this organization grow into this large national org or local org or whatnot, and you're going to be like, yeah, I did that. Yeah, I made that logo. Don't forget about the logo. So I found this other piece of quote that I want to read just because it's nice.
You did?
Well, she found it. Love cannot remain by itself. It has no meaning. Love has to be put into action, and that action is service. So this kind of embodies what we're doing. We're going to be that tool that Dr. Remington was talking about. They're going to be preventing people from developing those diseases in the future. Other than that, if you guys have questions, stick around. If you want to get, if you want to pay the membership fee, you can go and talk to Eliana. We're going to form a line somewhere if you want to give, take care of that right away. We're going to have a list on my laptop where we're going to enter the names and check you off. Other than that, thank you guys all for coming today. I hope you enjoyed the detail. I hope you guys enjoyed the lecture. Thank you to Dr. Remington. And we'll see you guys in 2 weeks.